Hi everybody. For those of you who don't know me, I'm Narina Wilkinson. I'm a plastic surgeon.
And I'm Dr. Serena Cardoso. I am a medical doctor with a special interest in aesthetics.
And today we start my 6-month countdown to my 50th birthday. Can you believe it? I've made a conscious decision that over the next 6 months I'm going to be the best I can be, body, mind and soul. So during this journey I'm actually going to share with you all the skin treatments I'm going to do, my body treatments, my facial treatments, and today is the first day we're starting my treatments, and we're going to start with a Botox injection.
Yes, I'm going to be giving Narina a little bit of Botox. Let's lie back.
Okay, so I'm getting comfortable here. And it's quite important to remember that when you're having Botox injections before any special event, is that you should actually always remember to start at least 6 months before the time, because your Botox needs to be tailor-made to your specific needs. And depending on what your muscles are doing, the doctor will be able to decide what they need to do. But sometimes we need to tweak these Botoxes. And if you have what I call a trial session about 6 months before the time, they can really tailor-made it to your specific needs and knowing that you can have the best results. So today Serena's going to start, and we're going to start with my crow's feet, and you can see these little lines here. Now I like to call them laugh lines, and some people call them crow's feet. I tend to not want to have all my lines gone, so I only use a small dose around my eyes. And that's what Serena's going to do. So she's going to give me tiny little injections just to soften those lines. But when I smile, I'll still have a little bit of a movement. So here comes my first injection.
Ready, Narine?
That was easy. Wow.
Not too painful?
Not at all.
You might have a little bit of redness.
That looks great. Okay, so that was very, very easy. So I'm going to have nicely softened crow's feet, which are now going to just be little laugh lines. Now I'm going to go to my frown area, and the frown is something nobody needs to have for any occasion. So I believe that that's probably the first that needs to go. You can see this muscle action, and so what we're going to do is we're going to inject a muscle relaxing injection, botulinum toxin, into that muscle, and that's then going to just relax it, and you're going to see tiny little injections. Again, hardly sore. Got a small little tear, but that's fine. That's it. So that's now my frown that's been treated. And in 3 days' time, I'm going to hopefully be frownless and just look totally relaxed and calm. Now when we get to the forehead, that's probably the biggest challenge, and I'm trying to just get this camera right, sorry about that. And as we age, you'll find that when you're young, you can put a lot of Botox on your forehead because you basically don't have that droop. But as we age, our brows start to droop, and then we find that the eyelid skin becomes more prominent. So when we're having Botox, and I'm sure some of you have had that bad experience where you've Botoxed your forehead and you found very heavy feeling afterwards. And that's why we use a very specialized technique where we're going to do what I call micro Botox. We're going to do small little injections into the forehead area and really just try and soften that skin muscle interface rather than paralyzing the muscle, so that I'll still have movement, I'll still be able to move my brows up and down, but the little lines will be softer. So here come the little injections. As I said, it's a very dilute Botox, full concentration, only about 5 units in the whole forehead. Now a normal concentration would be about between 10 and 15 to 20 units. So you can see it's a very small amount, tiny little injections, very subdermal, not even into the muscle, so that we can just soften that interface, but that we don't end up having relaxation of that muscle. A few more little injections on the other side. You can see a little bit of redness, a little bit of swelling, and probably it's going to take about 30 minutes for that to disappear. And what we will find is that the Botox will take about 3 or 4 days to start working. If you then find that you may have one side that lifts slightly higher than the other, often we need to tweak a little bit, and as I say, that's the perfect for your big function is that we can map it and we can really work out what is the exact treatment for you so that when you're having that big occasion that we can then have a great result. So that's my Botox done, and as I said, little drops all around. And well, I just want to see if there are any questions here. As I said, this is our first Facebook Live, so we still trying to learn, and I'm trying to see if I can answer any questions. But if anyone has any questions for Serena or for I, just let us know and we can try and answer them. Otherwise, well, hopefully we'll see you soon as I'm on this journey of looking fabulous for my 50th. And so we'll see you soon. Bye.
Bye, guys.